I come in?
Hi, yes.
Hi,
Hello.
I'm Sarah Fordham. I'm a student nurse practitioner. How would you like me to refer to you?
You can call me Amy, it's fine.
Okay, well, nice to meet you, Amy.
Mm-hmm.
I see that you, according to your chart, that you're here because you've been having some depression-like symptoms for several months.
Yeah.
How are you feeling today?
I'm tired. I'm tired. I'm not hungry. I have a headache. I just don't feel good today.
Okay. Well, do you mind if I ask you some more detailed questions about how you've been feeling?
Sure.
Okay, great. And a lot of times with when it comes to depression symptoms, I like to use this depression screening tool because it helps me identify the severity of your symptoms, and that way we can get the best help for you. Okay.
Okay.
All right. So in the past month, have you felt, let's say, one word to describe it would be hopeless?
Yeah. Yes, I have.
Okay. So how about feeling down or depressed?
Yes.
Okay. What about feeling tearful? Has that been happening?
Sometimes.
Okay. What about your energy level?
I'm just tired all the time. I can only do things for a short amount of time before I need to lay down.
Okay.
Mm-hmm.
And what about things that you used to enjoy? Have you been able to still enjoy those things?
I try, but it's just not the same.
Okay. What about feeling tired?
Yeah, all the time.
Okay. What about your sleep pattern? Has that changed?
It has. I have difficulty falling asleep, and then I wake up early, and I can't. I'm tired all the time, but I can't sleep.
Okay. What about your mood? Does that vary throughout the day?
Yes, my family had noticed some changing, and I can't notice so much, but my family does.
Okay.
Mm-hmm.
What about, when you're feeling down like this, it can affect relationships. And I see from your chart that you're married and you have 2 children.
Mm-hmm.
How has this affected your relationship with your husband?
Well, we don't have much of a sexual relationship, really.
Okay.
We haven't for quite some time since my mother came to live with us, and it's so exhausting that we don't spend that much time together anymore.
Okay. So, you mentioned your mom came to live with you.
Mm-hmm.
Is there a medical reason for that?
Yeah, she just wasn't able to take care of herself or live on her own anymore, so I have to take care of her, and it's exhausting.
Do you have any support with that?
That
help you, that any siblings or other family members that help you with her?
I'm the one that does most of it.
Okay.
On my own. Mm-hmm.
Okay, so, what about, now, how about any difficulty concentrating? For example, can you follow TV programs, read the newspaper without getting distracted?
I try, but I feel like I zone out when I do that.
Okay. Have you had any issues with memory loss?
A little bit. I'll forget, that where my keys are. I'll leave them in the door, and then I'm hunting for them, and then come back and find out they're still in the door.
Okay, so you have been having some memory loss, it
Mm-hmm.
sounds like. Have you experienced any periods where you felt like you've had high energy levels or euphoria?
Not really. Just, just kind of sad all the time.
Okay. What about, people who feel this way, the way you've been describing, sometimes they experience seemingly bizarre events or feelings. For example, have you heard any voices speaking to you?
No.
Telling you to do anything or harm anybody?
No.
What about seeing things that really aren't there?
No, nothing like that.
Okay. So, the way you're describing this, feeling very down, has anything made you feel so bad that you have thought of hurting yourself?
No, I haven't felt like doing that or anything like
Okay.
that.
What about hurting others?
No, nothing like that.
Okay. Have you ever had a plan to hurt yourself?
No. Mm-mm.
And have you ever tried to take your life?
No, I've never tried to do that.
Okay.
Mm-mm.
Have you ever had these types of feelings before, feeling down and depressed?
Not really. I can't remember a time that I was like that. Yeah, nothing like that. Last time I was here at the physician's office, I felt a little bit down, but not as bad as this. So I know they did like a screening, but this has just gotten worse.
Okay.
Mm-hmm.
Have you ever had to see a counselor to seek help for these types of feelings?
No.
Okay. Have you ever been admitted to a hospital for a mental health reason?
No.
What about family history? I see in your chart your mother has Alzheimer's disease. Are there any family members that have any mental health issues, psychological illnesses?
Well, my mom had Alzheimer's disease. She still has Alzheimer's disease. She's still alive. She's 92.
Okay.
And caring for her at the house is a lot of work. So, she also has high blood pressure and she's got high cholesterol. My dad, he died at 52 of a stroke. Even my son has high blood pressure.
Okay.
He's 40. Other than that, he's doing okay. And my daughter, she's fine. She's healthy.
Okay. So a little bit more about your living situation. Can you tell me some more about that? Who lives with you at the moment?
I live with my husband and my mom.
Okay.
My husband and my mom, they butt heads a lot. I think it's, she's got Alzheimer's, so she's very forgetful. And then, my kids, when they come over, they think that I am not handling the situation right and not taking care of her, but they won't help out, so I don't really have any options.
Oh, okay. What, do you have any financial concerns at this point? Taking care of her or financial burdens?
No, not really. I just, it's hard. I can't put my mom in a home or anything like that, so I feel like, I want to spend as much time as I can with her, so,
Okay.
and I spend a lot of time with her. I think my family gets a little upset because of that, too.
Okay. And, so a couple more questions about your social history. Has this mood affected your friendships?
Yeah. I haven't been able to go out and, spend time with any of my friends or anything lately. I'm always with my mom, so.
Okay. Now thinking about, do you have any history of smoking, past or present?
No smoking.
Okay. No tobacco use?
No.
Any alcohol use?
No.
What about any drugs?
No.
Okay. Couple more questions about your medical history. I see you take some medications. Can you tell me, just confirm the medications you're taking? Lisinopril, hydrochlorothiazide, and Tylenol as needed. Are there any other medications that you're taking?
No, those are the only ones.
Okay. Do you feel like those blood pressure medicines control your hypertension?
Yeah, I feel like they do.
Okay. What about, I just want to confirm your allergies. I see that you don't have any allergies to medications, or do you have any allergies to foods or environmental allergies?
No, nothing like that.
Okay. And, I should just kind of confirm some of the things we talked about and kind of summarize everything. So you've been feeling down for the past couple months,
Mhm.
difficulty concentrating and sleeping, lack of appetite.
Mhm. Yeah, I've even lost 5 pounds lately too.
Okay, all right. And you're having hard time keeping up with your friends,
Mhm.
and with your husband, your sex drive is low.
Mhm.
And what about work? What kind of work do you do?
Well, I retired 2 years ago. I was a bookkeeper, so
Okay,
yeah.
all right. Now, did you retire when you started taking care of your mother?
No, I retired 2 years ago, so we had a good year there where we were able to do lots of family things and travel, and then after that my mother moved in and it all stopped.
Okay. So, do you feel there is something wrong?
I feel like I'm not my normal self.
Okay. And what would you like? What's our goal here today? What would you like for treatment or from a treatment or a plan?
I just want to start feeling better, start
Okay.
having some energy.
Well, that's a good goal.
Mhm.
So, now I'm just gonna ask you a couple questions. Unless you have anything else to add right now.
Mhm.
A short review of your systems, and I work kind of head to toe when I ask you about these questions. So you tell me how you feel about that.
Okay.
Any headaches,
I do. I have headaches.
fever?
No fever.
You mentioned 5-pound weight loss, and I
Mhm.
do see from your vital signs from the MA that you have lost some weight. Your BMI is 19, so it's a little low. What about any issues with your bowels, such as constipation or diarrhea?
No problems with that.
What about any changes to sensation, hot or cold sensations?
No.
Okay. What about any night sweats?
No, nothing like that.
Okay. Well, with that, I think what we can do next is I can start the physical exam unless you have some questions.
I don't think so.
Okay. So if you wouldn't mind having a seat up on the table there. I know this might sound silly, but this is part of the exam, but I have to ask you a couple questions. Tell me your full name.
It is Amy May.
Okay. And what's your date of birth?
My date of birth is November 14th.
Okay.
Mm-hmm.
And tell me where you're at right now.
I'm at the clinic.
Okay, you passed. That's
Okay.
we just have to ask those questions. I'm gonna start with your eyes and kind of work down, okay?
Okay.
So first I'm gonna check your pupils. Okay, so I'm gonna have you stay looking at my nose. Okay. All right, now I'm gonna have you follow my finger with just your eyes, okay? Okay, great. Now I'm going to have you follow a couple commands here. If you could smile, puff out your cheeks, and if you can frown. Okay, can you lift your eyebrows up? Good. Can you clench your teeth? Can you feel here? Okay, good. I should apologize. I will put some hand sanitizer on. And typically we'd have our patients in a gown, but for today's purposes, we can't do that. So I will be listening with my stethoscope on your clothes this time instead of on your skin.
Okay.
So now I'd like to do some strength exercises. Can you squeeze my hands? Good. Can you push your elbows out? Good. And can you, let's see, I'm going to have you put your arms up like that. Can you pull the other way? Good. Can you push against me? Good. Can you push down? Good. All right. And then what we can do next is a little test on your cerebellar function. It's a kind of a brain test. I'm going through all the cranial nerves, okay? It's a neuro test. So with that, I'm gonna have you touch my finger and touch your nose. Touch my finger, touch your nose. And then with the other hand, touch my finger, touch your nose. Finger, touch your nose. Okay, good. And I'm just gonna feel here. Can you feel me touching your hands?
Yes.
Good. Touching your feet?
Yes.
Okay, good. And then I'm gonna have you stand, please. I'm gonna have you walk to the door. And then on the way back, if you can walk from heel to toe. Yep, walk on your heels, and if you can come back, you can just like heel to toe. There you go. Good. If you can stand there now and put your arms straight out. Now close your eyes. All right, good. And you can go ahead and have a seat. Thank you. And I'm going to test a couple of reflexes. And then here, let me have you rest that arm in there. Alright, so with that, I'm going to now listen to some lung sounds.
Okay.
Nice easy breaths in and out, in and out. Alright, and then I'm going to listen to your heart sound. Feel your neck here, okay? Alright. Can you turn your head to the right and swallow? Good. Okay, and swallow. Good. Okay. After that, we still have some labs pending. We did some lab work, so we will discuss that. Based on everything you described, I really think this is these are stress-related symptoms related to this caregiver burden that you're feeling. And, and it validates from the questionnaire you filled out prior to coming, and I appreciate you filling that out. So, some good things to come away from this is that it's good that you're here and seeking help. And, but I think you could benefit from a couple things. And one of the things I'm going to just give you some tips, and I have some handouts for that, are just some caregiver stress relieving tips. And one of them is just setting realistic goals for yourself. And, nobody's perfect at what they do, but you just do the best that you can. And it's important to accept help. Make a list of things that people can help you with, taking your mother for a walk, getting the groceries, cooking a meal, and also setting healthy goals for yourself, such as getting in a better sleep routine, and fueling your body with healthy food and plenty of water. And there's also some support groups, and you can really get some meaningful friendships out of those groups too, because you have things in common. So I think all of that can help, and I can give you some more information on that, and then we can discuss your plan and your labs here soon. So do you have any questions for me?
I don't think so.
Okay, well, thank you for coming today.
Thank you.